Generally, they're used to talking to their patients and they say, okay, you have pain. Well, I'm going to write you a prescription for X pain medication, or I recommend take 2 over-the-counter anti-inflammatories or pain suppressants, and try to get out there and do some physical therapy to restore motion, and that will help with the regeneration of the tissue. Well, we generally know what happens when you have to engage your arm, and you're only masking the pain when it's in a static position where you're not using it. When you actually involve that tissue, then the pain reemerges. And you're now relying on that individual in hopes of actually getting the physical therapy. So when a clinician adopts the technology, what they'll do is, rather than writing the prescription for an anti-inflammatory, they administer the treatment. And what they can show is an immediate reduction in pain, and also a clinical trial, which was placebo-controlled, randomized, double-blind, multi-centered. They can now show that it improved linear range of motion. So they can say, I've got you now to a step where you can use that arm, that you don't have to go through the rigors of physical therapy, just sustain the improved linear range of motion. And then they ultimately schedule appointments. Come back next week, let's get you another treatment. It'll take 5-10 minutes to get that treatment administered. And I can actually delegate the treatment to my support staff. So you may not see me next time, but you'll be able to have a treatment with my well-trained, exceptional support staff that you walk in, will get the treatment administered, and then you can get back out on the day 6 to 12 minutes later. And so you continue to do that until you see sustainability in your overall treatment outcome. And then that's the ultimate replacement for these medications, narcotics, opioids that simply mask something with no regenerative capability.